Hi, and welcome to today's presentation titled Brief Intervention for Adolescents, Brief Negotiated Interview Using Motivational Interviewing Strategies. So I'm Christina Dryman, and I'm going to be presenting today's session. I also want to recognize Tracy McPherson, who serves as joint faculty on this initiative and has led many of the adolescent SBIRT initiatives at NORC. So the information shared in today's session was developed by NORC at the University of Chicago and its partners with funding from the Conrad N. Hilton Foundation. So let's first discuss brief intervention. Brief intervention is defined as a behavioral change strategy that is short in duration and that is aimed at helping a person reduce or stop a problematic behavior. Motivational interviewing is defined as a communication method that is focused on the adolescent or young adult's concerns and perspectives and works to enhance their internal desire, willingness, and ability to change by exploring and resolving coexisting and opposing feelings about changing. So explicitly emphasizing autonomy during conversations with adolescents may be experienced as less threatening and prescriptive. And it also aligns with the developmental task of helping adolescents develop insight and confidence about making decisions that are in their own best interest. So although this presentation is not specifically focused on motivational interviewing, for those of you who are familiar with motivational interviewing, you'll see that the elements of motivational interviewing are infused in the brief negotiated model of brief intervention, which we will discuss in greater detail later in this presentation. So if screening indicates substance use, a brief solution-focused motivational intervention can be very effective in helping the adolescent or young adult reduce or stop problematic substance use involvement. Multiple BIs may be more effective than just a single BI. Practitioners can document the brief intervention in a way that makes it easier to continue where the previous conversation left off, to build rapport, and possibly enhance the effectiveness of the next conversation. So for example, note the pros and cons and readiness ruler number from the first conversation to refer to in the next conversation. And again, we'll talk about these tools in greater detail later on in this presentation. Usually brief interventions immediately follow a screening, and while a gap of a few days or a week may not dilute the effectiveness of the brief intervention, the likelihood that an adolescent or young adult will not show for the next scheduled appointment is increased if the time interval between a screening and the brief intervention is too great. Brief interventions usually include feedback about the screening score generated from administering a validated and standardized screening tools such as the CRAFT Plus N 2.1 or the S2BI. Polysubstance use among adolescents and young adults is common. Therefore, one suggestion is to start the conversation with adolescents by noting that they are all addictive substances that can have lasting harmful effects on the brain, health, and other areas of life, such as school, sports, relationships, etc. And then ask the adolescent where they like to begin, what they may be most willing to explore or are most concerned about or have questions about. And then finally, in some cases, it's best to use your clinical judgment about which of the substances they're using that are likely to cause the most immediate harm. Oftentimes it'll be alcohol, and you can lead with that. Brief interventions typically include feedback and discussion about the screening score generated from administering the validated screening tool, how the use level of use compares to national averages, or to adolescents of the same gender or age group, concerns about the potential effects of substance use during adolescence or young adulthood, pros and cons of use, negotiating goals, including a commitment to cut back or stop use, and commitment to action. A brief intervention can vary in length. It takes as little as 1 minute for some at no or low risk. And it can range from 5 to 30 minutes for those at more of a moderate or high risk, or it can stretch to one or several full-length sessions for those at high risk and when the youth is also agreeable. So now let's get into the brief negotiated interview, or BNI. So the brief negotiated interview is one model of brief intervention developed by the BNI Art Institute at the Boston University of Public Health. And on their website are a number of supplemental resources in the public domain. And so the BNI model is being used in a range of medical and behavioral health settings. The elements of the BNI are shown in this figure. This resource is commonly referred to as the BNI adolescent algorithm, and it's often found on a pocket card or on a one-pager that can be printed and used while learning brief motivational interventions during training role plays. And it can also be used as a tool to guide the provider in developing a brief intervention or delivering a brief intervention. And some versions contain sample dialogue to help the provider actually remember the steps. And so here's an example of a pocket guide that lays out the BNI steps and actually includes some sample scripting. So the first step of the BNI is engagement, building rapport with the adolescent. So building rapport is vital to the brief intervention. The first step in building rapport is to make sure the adolescent is informed that what is talked about in the counseling session will be confidential, except if mandated reporting is required. So you could say something like, our conversation will be confidential unless I find that you are at risk of harming yourself or another person, or that you're being abused. Then follow with a general conversation to get to know the adolescent, which includes relatively benign, but also still informing topics. And so the practitioner can start by getting to know the adolescent and asking questions. So for example, you could say something like, what's a typical day look like for you? What's the most important thing in your life right now? Then the topic can move to substance use. And it's important to ask permission to talk about their use of substances. And asking permission is an element that's drawn from motivational interviewing. So the practitioner could say something like, would you mind taking a few minutes to talk about your answers to your health screen? Alternatively, you could say, would you mind taking a few minutes to talk about your alcohol use? Where does your alcohol use fit in your life right now? The next step in the BNI is referred to as pros and cons. And in this step, you'll see where brief intervention and motivational interviewing intersect with motivational interviewing micro skills called OARS, O-A-R-S, being infused into the BNI model. And just to reiterate, OARS stands for open-ended questions, affirmations, reflection, and summary. So this step involves discussing the pros and cons specific to their individual substance use. Eliciting pros and cons may help bring ambivalence out into the open. And so exploring both positive and negative aspects of substance use can help the practitioner understand why they are using a particular substance. So asking about not so good things about their substance use carries more weight when the adolescent hears their own voice talking and stating the negatives of substance use. So after listing pros and cons, you want to reflect back the adolescent's response. So here's what asking about pros and cons might sound like. The practitioner should ask them about their use and what they enjoy about that specific drug. So you could say something like, I'd like to understand more about your use of alcohol. What do you enjoy about alcohol? When it comes to cons, eliciting cons, you could say something like, what is not as good about your use of alcohol? Then the practitioner reflects what they've heard. So on the one hand, it sounds like you feel relaxed and have less worries when you drink alcohol. And on the other hand, you say you feel tired and hungover the next day after drinking with your friends. Did I get that right? When summarizing the pros and cons of change that the adolescent mentions, make sure to emphasize both sides equally. By doing so, the adolescent can understand the dilemma and make a decision while maintaining neutrality of the practitioner. So by asking something like, did I get that right? You're making sure that what you've summarized is correct, and it gives the adolescent the opportunity to hear things back in their own words. The next step in the BNI model is to give feedback. So prior to giving feedback, it's important that the practitioner always asks permission to ensure that the individual is open to hearing some feedback. Asking permission to provide feedback builds rapport and ensures the adolescent is open to receiving it. So again, some examples may be, would you mind if I provide you some feedback about your alcohol use or your use of alcohol? Another option would be, as your provider, I want you to know that I'm concerned about your drinking. Would you mind if I shared some of my thoughts with you? And here's an example of providing feedback to the adolescent. So we know that for adolescents, drinking alcohol and using other substances such as marijuana, prescriptions, and over-the-counter medications can put you at risk for problems in school, accidents, and injuries, especially in combination with other drugs or medications. It can also lead to problems with the law or with relationships in your life. Additionally, you might want to say, what are your thoughts on that? Or in what ways is that information relevant to you? You want to elicit the adolescent's thought on that feedback that you've provided. So this step can also be used to share important educational information with the adolescent or young adult about the dangerous side effects or complications that can occur when they choose to drink, use other substances, or drive. And educating adolescents and young adults about their risks of health and other problems can help them to decide to change. However, it can be especially helpful to focus on the social and family impacts that the alcohol use may have on the individual, rather than just the physical long-term health effects. Education about alcohol and other substance use should be given regardless of the quantity and frequency of use. So for example, you could say something like, when teens drink, things can go wrong, like injuring yourself. Or when teens use any addictive substance while the brain is still developing, it can increase the chances that they will develop a serious substance use disorder in the future. And hearing that feedback may especially resonate with adolescents who are aware of people in their family who have alcohol or drug use disorders. It's also important to provide normative feedback, right? So adolescents and young adults tend to think that their peers use more than they think they actually do. Adolescents and young adults tend to think that their peers use more than they actually do. So practitioners should be sure to become familiar with prevalence rates and patterns of substance use in their area, so that they can provide this information during the brief intervention and compare their use to that of their peers. Fact sheets are not only helpful, but provide education to teens, but are also useful training tools to educate providers on patterns of substance use. So continuing a dialogue with the adolescent or young adult is very important. So asking simple, open-ended questions after the practitioner provides feedback is an easy way to elicit thoughts and feelings about the feedback. So for example, you could say something like, what are your thoughts on that? What reactions do you have to the information that I just shared for you? How useful do you think this information is? And it's common for adolescents to be ambivalent, reluctant, or resistant to change. So the next step in the BNI is referred to as the readiness ruler. To transition from this feedback stage to negotiate an action plan, it's time to assess the adolescent's readiness to change. And the readiness scale is used to quantify the adolescent's or young adult's readiness to change. And when introducing the readiness scale, the practitioner should first define what the scale is and then how it's used. So an example of this might be the readiness ruler is a simple 1 to 10 scale we use to determine your readiness to change your substance using behavior, with 1 being not ready at all and 10 being completely ready. The BNI is tailored to the individual's readiness, and some readiness rulers use a scale from 0 to 10, while others use a scale from 1 to 10, and both approaches are valid. So a visual tool such as a pocket card that includes the readiness ruler, shown on the bottom here, may be helpful. And as you can see, this pocket card contains other information that may be helpful to you or the adolescent when discussing alcohol use. And as you can see, this pocket card, in addition to the readiness ruler, can also be used to assess the importance of and confidence in their ability to make a change. So regardless of the number that they choose, it's important that the practitioner is positive and encouraging of whatever stage of change the adolescent is in, especially for those who express a higher score on the readiness ruler. The practitioner could say something like, "You marked 8. That's great. That means you're about 80% ready to make a change." After reinforcing that any change is good change, the practitioner should then investigate, why did you choose that number and not a lower one, like 1 or 2? What would it have taken for you to have chosen a higher number? Asking for a lower number can encourage more change talk than asking for a higher number. And starting with asking why not a higher number is likely to make the adolescent feel defensive and lead to what's known as sustained talk. And sustained talk is giving reasons not to change right now, talking against change. And so the more that we help adolescents to talk in favor of change, even if they're not ready to commit to change yet, the more it plants the seed of change that may eventually result in change. So when the adolescent chooses 0 or 1, suggesting they are not ready, use reflective listening, affirm autonomy, and elicit change talk by looking forward. You could say something like, "So right now, it's not at all important to you, or you do not feel at all ready to make a change. It's your decision about whether or not to change. Looking ahead, how would you know if alcohol was becoming a problem for you or preventing you from accomplishing the things that are important to you?" By looking forward, you can elicit likely outcomes in the adolescent's own words if they do want to make a change, and invite them to envision what change might look like in the future. The next step in the BNI is to negotiate the action plan. So negotiating an action plan includes creating options and steps that the adolescent or young adult feels are realistic and obtainable. So ask the adolescent if they can think of ways to reduce their risk of substance-related problems, ways that make sense to them and that they can see themselves trying. Some of the options the adolescent might suggest, or the practitioner could prompt for, include a trial period of no use of a specific period of time. And this can often reveal the adolescent and practitioner that a substance use disorder is becoming more severe or problematic. And in some cases, this may be a wake-up call for the adolescent who is certain they could easily quit anytime. Also, reducing alcohol intake by maybe 1 drink per drinking session, setting a limit on the number of substance use days per week, counting drinks, not driving after any substance use, avoiding triggers for excessive use. So starting early at happy hours, engaging in drinking contests, playing beer pong, or going to a gathering where substances will likely be used. So for adolescents whose substance use puts them in the moderate or high risk categories, simple advice to reconsider their substance use patterns, cutting back or abstaining, can be very powerful. So non-confrontational advice expressed with concern can motivate many people to change or rethink their use. So an example may be, have you considered cutting back on your drinking? Reducing your alcohol use could reduce your risk of problems, and cutting back could really help you concentrate on the issues that led you to come in today. Additionally, you could say something like, I'm concerned that your continued drinking at this level may make things worse. I think following the recommended drinking guidelines would help make things better. Additionally, you could say, if you're not ready to change, you might consider doing 1 or more of these things. keeping track of how often and how much you're drinking. Notice how drinking affects you. List pros and cons of changing your drinking, dealing with things that may get in the way of changing, and asking for support from your doctor, a friend, or someone else you trust. So as the practitioner and adolescent discuss what the action plan could include, it's always a good idea to write down the steps and ideas discussed and have the adolescent write down their goals and next steps in their own words and handwriting if possible, as this may carry more weight than the practitioner writing it for them and actively engages them in developing the action plan. So some example dialogue is, those are great ideas. Is it okay for me to write down your plan, your own prescription for change to keep with you as a reminder? The next B&I step is to summarize and think. So the brief intervention should end with summarizing and reviewing what was discussed, going over the action plan, and ensuring that all questions have been answered. So reinforce resilience by summarizing the discussion, and in particular, focusing on the adolescent's strengths, their interest in problem solving, and their openness to change or engage in a difficult discussion. So for example, will you summarize the steps you will take to change your alcohol use? Or let's summarize the steps you will take to change your alcohol use. I've written down your plan, a prescription for change, to keep with you as a reminder. Do we have this correct? And we talked about possible challenges and ways to address them. So at the end of the brief intervention, it's important to reinforce resilience and remind them of the resources they have available while making this change. These resources may include friends, teachers, parents, school or community-based groups, further assessment, intensive substance use treatment, mental health treatment, or self-help groups, among others. As practitioner, become familiar with each type of resource so that you can discuss what these options or what options are available for the adolescent. Provide the adolescent with handouts or additional information on outpatient counseling, primary care providers, mental health and addiction counselors, and self-help groups, including Alcoholics Anonymous, Narcotics Anonymous, and Smart Recovery, to name a few. And if a referral is part of the plan, conduct a warm handoff to the referral source. Set a follow-up appointment to check in with the adolescent at a later date. Specifying the follow-up plan conveys that the practitioner views substance use as a serious issue that warrants follow-up, just like any other medical issue deserves follow-up. And follow-up can take place by phone or the use of other technology, such as text messaging, maybe a patient portal or smartphone app. The practitioner may ask something like, which of these services interest you at this point? And one of the final steps of the B&I is to hand the adolescent or young adult a copy of the finalized action plan. And so the practitioner might say, here's the action plan we discussed along with your goal. This is really an agreement between you and yourself. Finally, thank the adolescent or young adult for taking the time to speak about the important topic. And if applicable, tell the adolescent they can use the practitioner as a resource that they can feel free to contact in the future. The offer of follow-up is often seen as an offer to continued support. So for example, thanks so much for sharing with me today. I'd like to follow up with you in a few weeks and check in on your progress towards reaching your goals. Would that be okay? And if you'd like to learn more about the information that I've shared today, we recommend the Learner's Guide to Adolescent SBIRT Module 3, Brief Intervention, which provides step-by-step instructions for implementing a BI or a brief intervention based on the brief negotiated interview model. More information on conducting a brief intervention with adolescents is available in part 2 and 3 of using SBIRT to talk to adolescents about substance use, part of the on-demand webinar series at sbirt.webs.com/webinars. That'll conclude today's presentation. Thank you.